So once I have this cocked and I've got it full of my fluid, there are 3 different places that I can put it in. All intramuscular, and I'm going to cover from the least ideal to the most ideal. The least ideal location is in your deltoid. So right up here where your arm meets your shoulder kind of. The reason it's not ideal is because it's a small muscle. Many intravenous drug users are really emaciated, they're really undernourished, and we've heard horror stories of either hitting bone or when we were using the longer needles of actually going straight through and it poking on the other side. So that's not ideal. Or conversely, if someone is overweight, then they may have enough fat that you aren't going to hit their muscle. So that one's not great. The only benefit of this one is that it's fairly accessible. It's fairly easy to get to. The next best option, the middle of the road option, is in the buttocks. Buttocks is the biggest muscle in the human body. You're pretty much guaranteed to hit it. So that's the bonus. The drawbacks of the butt are a couple things. Number one, if someone's passed out on their back, you may not, if it's a 90-pound girl walking through Galt Gardens who comes across a 300-pound male, she may not be able to get to that area. Number 2, the sciatic nerve runs through your butt, and so if you hit that, you risk paralyzing somebody. Number 3, we know that many drug users have a history of sexual trauma. When they come to, they're likely already going to be pissed off at you because you have canceled their high. They don't know that they were overdosing. Keep that in mind, right? So when someone comes back from a near-fatal overdose, they don't know what kind of trouble they were in. From their experience, they were just having the best high of their life. So they're going to be upset with you because you have ruined the best high of their life, you have wasted the money that they spent on that drug, and they feel like garbage now because they're experiencing dose sickness. So if you're also fishing around in their nether regions and they have a history of sexual trauma, then that can be re-traumatizing for them and can escalate things pretty quickly. Best bet, just go into their thigh. You want to go into anywhere, any of those areas at a 90-degree angle. So I'm going to cap this so that I don't stab myself, which I have done. If you go in like this or like this, you're not going to hit muscle, right? You're just going to skim right under the skin. So you want to go in at a 90-degree angle to wherever you're doing it. And you want to go in as far as you can. So you want to go in right up to what's called the hilt, where the needle ends.